anterior outer lip of the iliac crest and ASIS. Anterior outer lip and ASIS. And it goes to, inserts into the iliotibial tract, the IT band, the fascia lata, which is why it's called the tensor fascia lata, because it tenses the fascia lata. Okay? Yeah.
Do you know what the lata means?
No, I did, but
So, most of the words are in the back of the book on like from, for, something to add what the Latin means.
lata, ladder,
Broad.
broad.
Okay.
It's a broad. Okay. Now, what else inserts into it? Gluteus maximus. And the tensor fascia lata, next page, inserts on the tubercle of the iliac crest to the lateral knee. I feel sorry for you. There, that's better. What's this sucker going to do?
It's going to abduct and laterally rotate.
That's good. What's it going to do? Do I really need it to abduct and laterally rotate? Huh? No, it's anterior. When I'm standing and I contract the gluteus maximus and the tensor fascia lata, what is it doing? Fascia lata. Now you can use your word if you want. Forgot who uses it a lot. You. It stabilizes the knee and what? Extension. It helps maintain extension. Now, when we talk tomorrow, we're going to talk about the screw home mechanism. It sounds like an interesting thing, doesn't it? That's actually Thursday. When I say tomorrow, I mean Thursday, because I don't know days anymore. I get up in the morning and ask my wife, what day is this? Do I go to church today, or do I do something? Your folks are just confusing my week. This isn't a normal week. It's helping maintain the extension. Now, somebody said flexion. It actually can work as a flexor if the knee is in, huh? No. The knee doesn't abduct. If the knee is in flexion. See, if you got something right here, if I'm in extension, it's anterior to the axis of the joint. But if I flex, now it is posterior, but it's hardly needed then. So the tensor fascia lata, and somebody said abduction. Yes, it is. Now, why do we give a hoot? We don't.
If a patient has a weak.
No. You gotta strengthen whatever muscles are there. We give a hoot about the tensor fascia lata not when it's working well, but when it's tight. Because it's a contributor to actually back pain. I want to tell you a little story. That here, this is something to keep in mind. You want to really look good out in the clinics? See something nobody else sees. Donna Ryland was one of my graduates. She was an intriguing gal. She was Miss Asia in weightlifting for 2 or 3 years, and Miss Philippines in weightlifting for 5 years, and then she came here. And Elvis Brandon, you know who Elvis Brandon is? Your dean. He used to be the ACCE here. He had taught the knee, but he also talked about something else. And she went out and she solved a patient's problem. They wanted to know, where did you learn that? She said, well, at Ball State. If I were doing the foot, you see, I had planned to do the foot and ankle because that's what I thought I'd do. We're going to talk about the proximal tibiofibular joint is not part of the knee. But where does it hurt? In the knee. And she pointed out that, you know, this patient's knee pain isn't knee, it's ankle. And she solved the knee pain by taking an ace bandage and wrapping it around the tibiofibular joint. Little things like that. Okay.
So you're going to do the foot and ankle too?
Now, I think David's supposed to come back. You can keep trying, but it's not going to work for you. If the tensor is tight, it puts stresses all over. Now, the other story I was going to tell you is my patient who had 2 knee replacements, same side. She had a knee replacement. Her knee pain didn't go away. So she finally harassed the orthopedic surgeon enough to do another knee replacement. Her pain didn't go away. Then finally somebody got the crazy idea to x-ray her hip. There wasn't anything wrong with her knee. It was her hip. It was referring to the knee. If you mess up something somewhere, it very often will appear elsewhere. If I don't look at you folks over here enough, it's because I don't have a visual field. I've lost part of the visual field over here. It took a long time to find out why. If the tensor fascia lata is tight, it will reflect in maybe the hip, but also in the back. I think we got an idea how you would test for tightness of the tensor fascia lata. Huh? Oh, no, it's way too fancy. Okay, I'm back up subject. Any of you, but I'll take the subject.
Mine's tight, so.
Oh, well, that's all the better. Oh, both sides?
Not so much a stretch this morning, but.
Yeah. Well, put one other side's the tightest up and look that way. On the top, yeah, because I'm going to test it on the top, not the bottom. So if it's the right side, you lay head there looking that way.
Okay.
Side.
Sideline.
Sideline. Okay, now what does it do?
Abducts.
It abducts. If it were tight, what position would the person be caught in?
Adduction.
He would be stuck in abduction. But what does it also do? Yeah, that's nice. No, the tensor doesn't. The muscles attached to it do. What else does it do? Not flexes. Extends the knee. So what do you do to test for tightness? If my elbow flexors are tight, what do I do? Try to put them in extension. Okay, so what I'm going to do is bend his knee, bring it up here. I'm going to get him in neutral and say, just relax. He is right. He's not real tight. Now, I'm making a mistake. Now, relax. It should go down to the other side. Okay? I figure out how to test it. If it's tight, it will keep him in
Abduction.
abduction. It will keep him in abduction, and it is. Now watch when I let go. Why does he go down when I let go? Huh? Well, gravity, yeah.
You're releasing the tension
My
off.
knee's no longer in.
Huh?
You're releasing the tension off the knee.
No, it's not so much that. What else can move? No. Somebody said the hip. The hip is a joint. The pelvis. If I don't hold his pelvis up here in neutral, gravity pulls the pelvis this way, and it looks like the femur is free to go down. Okay, thank you. This is fun. You know when it'll become the most fun? When you see this in a patient and you figure out, oh my goodness. See, I have a philosophy of the PTA that's probably different than the APTA. I want you to tell me what to do. Angela Long, I worked with for a long time, would tell me what to do. Now, once in a while, she'd get stuck. And I'd come in and say, hey, Angela, have you thought about this? But she'd pretty much tell me what to do, when to do it, and everything. That was our agreement, especially toward the end when I couldn't remember where I was. Certainly couldn't remember the names of the patients. She'd go through a whole scenario. They'd tell me what the dog's like. The name wouldn't do it, where they live, what the family's like, and eventually she might get something out of me. I was really pleased when I found another PT that had the same problem. She said she couldn't remember the patients. Quadriceps femoris. Now, why are the quadriceps femoris here in the hip? Because there's 3 vasti and 1 rectus. On Thursday, I got it right. We will talk about that when I was a little PT, the quadriceps consisted of 4 muscles. Now they consist of 5. And they didn't name it quinticeps. I'm sorry, they should have. The rectus femoris comes from the anterior inferior iliac spine. This is the anterior superior. Below it is anterior inferior iliac spine and a rough area above the acetabulum, so here. And it goes distally, becoming a tendon 2/3 of the way down to attach to the top of the patella and is reflected to the tibial tuberosity. We'll talk a little bit more about this on Thursday when you feel a little less overwhelmed by that point. But we have a trouble naming this thing down here. But from the patella to the tibial tuberosity. And we'll talk about what the patella is for. Right now, we're just going to say that this muscle does 2 things. It comes anterior to the hip, so it's a hip flexor, and it comes anterior to the knee, so it's a
Extensor for the knee.
extensor. Anybody have trouble with flexion and extension? Especially when you get to the knee? What is this of the ankle? I know it's dorsiflexion. I want to know what it is.
Flexion.
No. Look, that's extension, isn't it? What if I bring my toes up? That's extension, isn't it? So why wouldn't bringing the foot up be extension? And pushing it down is flexion. See, what happens is moving anteriorly is flexion till you get to the knee, and then anything posterior is flexion, anything anterior is extension. Now that's why we talk about dorsiflexion and plantar flexion, because people can't remember, but the extensor hallucis longus extends the toe. What does it do at the ankle? It extends the ankle, which is dorsiflexion.
Can you do that? Want to do that again? Do that.
I doubt it. Rarely can I do anything. Okay.
So anything below the knee,
Moving anterior,
moving anteriorly below the knee is extension.
and moving posterior is
Flexion.
flexion. But they did dorsiflexion and plantar flexion because we couldn't remember what it was. But sometimes in understanding muscle function, it's helpful to know that. Because you don't really want an extensor flexing. Now the vasti, we'll talk about later, but they come from the intertrochanteric region, which means they attach to the bone, the femur, and go down to the tibial tuberosity. So they are pure knee extensors, except for the obliquus that we'll talk about later. Okay. Now, is the rectus extending my knee? Okay. Partner next to you, have them sit. Put your hand here and see if you can feel the rectus. Now the person's leaning forward, and then what I want the person to do is lean back and feel what the rectus is doing. Now remember, the rectus isn't going to be felt down here, because down here it's already a tendon. It's going to be felt up here. And I think you'll feel a difference if the person leans forward versus if the person leans back. Why isn't the rectus femoris active now in extending the hip? Extending the knee. Huh?
Active insufficiency.
Did you hear that?
Active insufficiency?
It's in a position where if it works, because I have my hip fully flexed, if it works, it's going to get too short. So I'm putting it into a position of active insufficiency. So is this a good way to strengthen the rectus? No, this will strengthen those vasti, but the rectus is relaxed. Why on earth do I want a rectus?
Stand up. It's called a rectus.
Rectus means long, skinny sort of thing. Yeah, but what do I want a rectus for? Any of you here football players?
Sure.
When do you need a rectus? When are you simultaneously flexing your hip and extending your knee?
Driving.
I think of one particular activity.
Kicking the football.
Kicking the football. That's a rectus. I need a rectus when I'm doing things like flexing my hip and extending my knee, like in swing, initiating swing. If I'm back here and I use the rectus, it initiates my swing. What are the hamstrings doing about now?
Starting to contract.
Hmm?
Like backwards. You're starting to contract and put it like that.
Do I really want to pull my leg back?
Are you
Are you talking about the femur? Okay, yeah, but what else are they doing? We'll go over this again on Thursday, but what are the hamstrings doing now? What are the quadriceps doing? They are extending my knee, are they not? Are muscles smart? If the hamstrings work, if the vasti and quadriceps work, what's going to happen at my knee?
Hyperextension or extension?
It's going to extend as far as it can go, and if I keep doing that, well, I'll screw up my knee. I want a technical term here. Screw up my knee. So what are the hamstrings doing?
They're gonna be antagonists to that motion.
Eccentric contraction.
They're going to flex it.
Eccentric or isometric? Okay, because what they're going to do is stop the knee extension. Because when I walk, it is very rare that I have my knee fully extended. Okay, so they're working together. So you see, the rectus isn't always a knee, can't always extend the knee, because if the hip is flexed, it's So this is a lousy exercise if my goal is to strengthen the entire quadriceps. All I'm getting here is the vast.
So you'd want hip extension if you were.
If I'm going to strengthen the rectus, I need to put it in a good link tension relationship, which is it's got to go in about the middle, 60% of the excursion. It's got to work in here, so it'll keep working. Now what if, well, no, that's too far. We don't want to go there.
So, doing that exercise with hips extended, that would be the best way to get your full quadricep, is what you're saying. And the best way to actually engage your,
Yeah, there's one other way that I might do it. If I want the rectus, let's suppose I want to really concentrate on the rectus. Then I would hold my knee in extension, lock it. We haven't mentioned the screw home mechanism other than just mention it.
like sitting or standing like
I would be supine,
that? Okay.
okay? I would lock the knee so that the vasti are just maintaining an isometric contraction, and then I would do straight leg raising with the weight. That would bring in the rectus, but it'll also bring in the hip flexors. Okay, and it's hard to do just the rectus.